Ariel with RecoverRx Physical Therapy. Today's installment of Curiosity Corner is going to be about urinary incontinence. It's very common, but it's not normal. This happens to women and men across the world, and unlike in the movie Billy Madison, it's not cool to pee your pants. So I want to talk about the 3 different types of urinary incontinence or leakage, and I want to talk about how we differentiate that and then how we go on to treat those. So the first is the most common, stress urinary incontinence. You've probably seen this in social media, all over television. It's when women or men are jumping, they're laughing, they're sneezing, they're coughing, and they're having urinary leakage. So that is an involuntary loss of urine through something that caused enough pressure abdominally to push on that bladder and to have your pelvic floor muscles not be strong enough or coordinated enough to stop that leakage from happening. So that's the first. The second is urge urinary incontinence. So that's going to occur when the bladder is stretching either too much and you're getting this sensation that you have to go, but you can't make it to the bathroom in time. So we want to figure out what's going on. Why are you getting that urge? Why is that bladder giving you a signal earlier than needed? And why is that signal being so strong? The third type of urinary incontinence is going to be mixed. So it's a combination of someone experiencing that stress-related leakage and that urge-related leakage. So once we figure out and diagnose which one you're dealing with specifically, then we can come up with treatment plans. So for stress incontinence, we want to look at how strong are your pelvic muscles through a pelvic exam. How well do you manage pressure? And pressure can be increased in a variety of different ways, and some that you don't even realize. Going from a sit to stand position, right when I lean forward, I'm putting pressure down on my internal organs and on my pelvic floor. Rolling over in bed. These are simple movements that you do every day that can cause leakage or lead us to figure out if there's dysfunction or not. With urge urinary incontinence, we want to look at what are your environmental factors that are influencing that urge. Are you drinking a lot of coffee? Are you drinking a lot of carbonated beverages? A lot of acidic type of foods, lemonade, tomato-based products? Do you have triggers? Is it every time you pull your car into the driveway, now I get this sudden urge to go to the bathroom? Once we start to identify some of those triggers, we can start to help you heal and recover from that. And then lastly, with mixed urinary incontinence, we're looking at both of those factors. Typically, we're going to treat the incontinence that's happening more often or what's the biggest problem for you, and then we work through the other one. So we're getting a full picture of why is this happening, what's the root cause as to why it's happening, and then how to treat it. So if you have any other questions on this, please reach out to us. We can talk about different strategies and things to help you. We can do discovery screenings, and let's get this figured out because let's be real, it happens and it's very common, but it's very embarrassing. So we want to make sure that you're not embarrassed going to the gym, jumping, and doing everything that you want to do. Thanks.